What if your immune system, the very thing designed to protect you, suddenly turned against your own body? Imagine waking up every morning with stiff, painful joints. Your fingers feel swollen, your wrists ache. Even simple tasks like opening a jar or buttoning a shirt become intensely difficult. For millions of people worldwide, this isn't a hypothetical scenario. This is daily life with rheumatoid arthritis. But what exactly is this condition? Why does the body's defense system go rogue? And what truly happens inside a joint when this disease takes hold? Today, we're going on a journey deep inside the human body to uncover the science behind rheumatoid arthritis. To understand rheumatoid arthritis, or RA, we first have to talk about the term autoimmune. Your immune system is a complex network of cells and proteins that defends your body against infection. It's supposed to recognize the difference between foreign invaders, like bacteria, and your own healthy cells. In an autoimmune disease, this recognition system fails. The immune system mistakenly identifies your own body as a threat and launches an attack. In the case of rheumatoid arthritis, the primary target is the lining of your joints. Our joints are engineering marvels designed for smooth movement. They are protected by a thin, delicate membrane called the synovium. The synovium's job is to produce a special fluid that lubricates the joint, almost like oil in an engine, allowing bones to glide past each other without friction. In RA, the immune system mistakes this healthy, essential tissue for an enemy. The result is a relentless, self-sustaining fire of inflammation. This is the crucial difference between RA and the more common wear and tear arthritis, osteoarthritis. Osteoarthritis is often related to age and mechanical stress, but RA is driven by immune dysfunction. This is why it can affect people at almost any age, from young adults to those in their prime. So let's zoom in on what happens inside a joint during this misguided attack. When immune cells invade the synovium, they don't come quietly. They release a flood of inflammatory chemicals called cytokines. These are the chemicals that signal the alarm, causing the classic signs of inflammation: swelling, warmth, redness, and pain. Under this constant assault, the synovium fights back in the only way it knows how. It grows. It becomes thickened and swollen, and fluid begins to build up within the joint capsule, creating that puffy, tender feeling. Over time, this inflamed synovium can transform into an aggressive, invasive tissue called a pannus. This pannus is destructive. It grows over the surface of the joint's cartilage, the smooth white tissue that cushions the ends of your bones. The pannus releases enzymes that act like acid, actively dissolving the cartilage. As the cartilage breaks down, that protective cushion disappears. Bones begin to rub directly against each other, causing severe pain and, eventually, permanent joint damage and erosion of the bone itself. This destructive process is why early diagnosis and intervention are so critically important. The goal of modern medicine is to stop this cascade before the damage becomes irreversible. Because this damage can be permanent, recognizing the early warning signs is key. Rheumatoid arthritis often develops gradually with subtle clues that can be easy to dismiss at first. One of the most classic and earliest symptoms is morning stiffness. This isn't just the minor stiffness you might feel for a few minutes. For someone with RA, this stiffness can be profound, lasting for 30 minutes, an hour, or even longer, making it difficult to get the day started. Other common symptoms pile on top of this: joints that are consistently painful, swollen, and warm to the touch. But one of the most distinctive features of RA is its pattern. It tends to be symmetrical, meaning it affects both sides of the body at the same time. If your right wrist is affected, your left wrist probably is too, both hands or both knees. This symmetrical pattern is a major clue for doctors. The disease also has a preference for starting in the small joints of the hands and feet. And beyond the joints, a deep, persistent fatigue is incredibly common, a tiredness that feels bone deep and isn't relieved by rest.
Now, it's a common misconception that rheumatoid arthritis is only a joint disease, but the inflammation at its core is systemic, meaning it can travel throughout the body and affect many different organs. Think of it like a fire that doesn't stay contained in one room. This systemic inflammation can impact the lungs, causing shortness of breath. It can affect the eyes, leading to dryness and inflammation. It can even affect the skin, with some people developing firm lumps under the skin called rheumatoid nodules. Most seriously, the chronic inflammation of RA puts a significant strain on the heart and blood vessels. It accelerates the process of atherosclerosis, or hardening of the arteries, significantly increasing the risk of heart attack and stroke. This is a major reason why medical professionals take RA so seriously. It's not just about achy joints, it's a whole body disease with serious potential consequences. So, who is at risk? Scientists are still working to understand the exact cause, but we know it's a complex mix of genetics and environmental factors. Certain genes, particularly in a family called HLA genes, can make you more susceptible. If a close family member has RA, your risk is higher. But genes are only part of the story. One of the most significant environmental risk factors is smoking. Smoking not only increases the risk of developing RA, but is also linked to more severe disease. Hormones also appear to play a role, as women are affected 2 to 3 times more often than men.
The disease most often strikes between the ages of 30 and 60, but it can truly develop at any point in life. Diagnosing RA isn't straightforward. There's no single definitive test. Instead, doctors act like detectives, piecing together clues from multiple sources. They start with a thorough medical history and a physical exam, looking for swollen, tender joints and that classic symmetrical pattern. Then come the blood tests. Doctors look for specific autoantibodies, which are proteins made by the immune system that target the body's own tissues. One is called rheumatoid factor, or RF, but a more specific and telling marker is called anti-CCP. The presence of anti-CCP antibodies is highly predictive of RA. They also measure general markers of inflammation in the blood. Finally, imaging like X-rays or ultrasound can be used to look for early signs of joint damage. Now for the most important part, the hope. While there is no cure for RA, treatment has been revolutionized over the last decades. The goal of modern therapy is to achieve remission or at least very low disease activity. This is done with a class of drugs called disease-modifying anti-rheumatic drugs, or DMARDs. These medications work to suppress the overactive immune system and halt the inflammatory process. In recent years, a powerful new class of DMARDs called biologics has become a game changer. These are highly targeted therapies engineered to act like smart bombs that block specific inflammatory chemicals like TNF-alpha or IL-6, which are major drivers of the disease. There are also newer oral medications called JAK inhibitors that work from inside immune cells to interrupt inflammatory signals. But treatment isn't just about medication. A holistic approach is key. Physical therapy helps maintain joint function and strength, and lifestyle changes make a huge difference. Regular, low-impact exercise, like swimming or walking, can reduce pain and stiffness. An anti-inflammatory diet, rich in fish, fruits, and vegetables, can also help manage symptoms. Rheumatoid arthritis is so much more than joint pain. It's a complex autoimmune disease where the body's protectors become its attackers, leading to inflammation that can damage not just joints, but the entire body. But knowledge is a powerful tool. Recognizing the early symptoms, seeking a diagnosis, and starting treatment can make a world of difference. The sooner that fire of inflammation is brought under control, the better the chances of protecting your joints, safeguarding your health, and living a full, active life.